welcome back to my channel, Mental Health with Melissa. If you're new here, please don't forget to hit that like and subscribe button for more content. I post new videos every single Sunday and Wednesday, and subscribing to my channel helps me get mental health information out there to our communities of color and tons of free LCSW test prep. I have a study with Melissa social work LCSW exam test prep program that's available for purchase at the link below in the description box, so feel free to check that out. In the meantime, we're going to go ahead and get back into the content of LCSW test prep. If you're new here, I am a social worker, clinical supervisor, therapist, and a PhD psychology research student who really enjoys teaching and providing mentorship services. So let's go ahead and get into the video. So we're going to be doing things a little bit differently today. Usually what I do is I give information on the topic, and then at the end of the video or in a separate video, we then go over LCSW test prep question. However, today I want to actually do it backwards and do the vignette and the LCSW test prep question first. And then after, we're going to go over the information and the content of what the question is asking. So let's go ahead and read this. I really encourage you to pause, read it, select your answer, and then compare it afterwards. A social worker at a hospital meets with a client referred for 12-step meeting resources. The medical provider referred the client after the client presented for alcohol detox after a relapse. During the meeting with the social worker, the client endorses that he was also diagnosed with generalized anxiety disorder. The best way to describe the client's mental health and addiction is, so we're looking at the best way. So all of these options or some of these options may all seem appropriate. An appropriate way to describe what the client is going through. However, there is a best way. So we're going to want to really look at what would be the most maybe clinically appropriate way to describe the situation. All right, let's go through the options. Option A, experiencing relapse. So yes, the client is definitely experiencing relapse. However, there's a couple of things going on in this vignette, so we really want to make sure that we are getting a whole picture in the way that we may clinically describe the client, whether it be in a case conference to other colleagues or for giving kind of a brief case presentation to others. So let's go ahead and look at the other options. Option B, in need of treatment. So the client may need more residential treatment. We haven't really explored that with them yet. So that doesn't really seem like that captures what we really want to capture out of this vignette. Option C, dual diagnosis. So we're going to be talking about dual diagnosis in this video today. So if you understand what dual diagnosis is, then this may be the appropriate answer. Let's look at the last option, suffering from anxiety. So this is that tricky part that I was telling you about, because it does look like the client is suffering from anxiety. They've noted that they've been diagnosed with generalized anxiety disorder. So this could be an option. However, we're looking at the best way. So because of everything that we went over, experiencing relapse, in need of treatment, suffering from anxiety, these may all be ways to describe, but dual diagnosis is going to be the best way to describe what's going on, because the client is dealing with both a mental health diagnosis and also a substance dependence. So that's what dual diagnosis is. So now I want to get into what dual diagnosis means, some of the key definitions of dual diagnosis, and another term that we sometimes use interchangeably with dual diagnosis. So let's go ahead and get into that. All right, so let's go ahead and read this. You can read along if you're visual or if you're auditory learner, and then listen. Dual diagnosis is a condition of having a mental illness and a comorbid substance use disorder. There is considerable debate surrounding the appropriateness of using a single category for a heterogeneous group of individuals with complex needs and a varied range of problems. So, dual diagnosis, as I mentioned earlier, and kind of a follow up to that, is this understanding that substance use disorder and a mental illness can exist simultaneously. So, in my work in the past as an addiction therapist, I would meet with clients that would be referred to me, for example, for maybe stimulant use disorder or alcohol dependence. And then while kind of discussing the historical components of their dependence, so a lot of the time they would then bring up a really severe trauma that has happened in the past and would meet criteria for PTSD. So that was a very common dual diagnosis I would see. So substance dependence or a substance use disorder, um, along with a diagnosis of PTSD. And like in the vignette that we just looked at, we see that that really incorporated, that alcohol use disorder, along with the generalized anxiety disorder. So now I want to look at a different term. What is the difference between co-occurring disorder and dual diagnosis? So dual diagnosis or dual disorder refers to an individual who has both a mental disorder and a substance abuse disorder, like we just talked about. The term co-occurring disorder is a more recent term that means kind of the same thing, but it can also refer to other combinations of disorders such as a mental disorder and intellectual disabilities. So, co occurring disorder is a lot of the time used interchangeably with dual diagnosis, and that's okay. What I see more often with co occurring disorders are somebody that doesn't necessarily need to have an addiction and then a mental illness, but rather can be several mental illnesses, or several mental health diagnoses, like somebody that may be struggling with generalized anxiety disorder, major depressive disorder, and maybe borderline personality disorder. So there's a lot of different mental health co occurring disorders as opposed to strictly just addiction or some sort of substance use disorder and a mental illness. So those are the general differences. Thank you so much for watching. I hope this video was helpful to you. If you have any questions, please leave them in the comments section down below. And if you have any video requests, again, leave them in the comments section. Until next time, managing mental health matters.